Thank you for joining us. Today, it is my pleasure to invite our friend, our class fellow, our dear Dr. Muhammad Nadeem Kashmiri. I will address him as our Kashmiri friend because he's famous for that. And thank you for joining us, uh, Nadeem. Welcome, and let's start our discussion.
Uh, Thank you very much, Farhan, for inviting me on this. I'm really glad that you started this interview, and it's a mean of just communication, remembering all the past events which we spent beautiful time, really wonderful part of our life which we spent together at Orthopedic Medical College. And I'm really glad to, and I must appreciate your interview skills. That you have been doing a great job. I watched a couple of interviews of Ahmed Hassan, Naveedullah, Asfar. You did a great job.
Oh,
I
thank you
must
so much.
appreciate.
Nadeem, I think that I have been missing our class so much. It is just my natural feeling. I'm so excited and thrilled to know you, reconnect with you, that I have no ways of expressing my feelings. I would start this interview with the same question I've asked everyone else, which is, why did you choose to become a physician? What was the driving force or the reason behind?
Farhan, an interesting question. Basically, I was the first member who became doctor in my family. From both my mother and my father, from both families, there was no doctor. So my mother, she was very interested that I should become a doctor. Uh, Personally, I wanted to join forces, and but my mother, she asked me that it's better you should join medical, and then I started just making my interest in medical, and decided to keep myself in pre-medical, and then by the grace of God, I was able to get the admission at Orthopedic Medical College. So this is how my passion was to be to join forces. But my mother, she asked me, and then I guess it was the blessing of God, and because of her prayer, so I become a doctor. So I'm happy with that.
You know, I agree with you. The fact that sometimes now, since we are parents, we can see what our kids have the potential to do or what would suit them. And of course, it's their final decision to do what they want to do. But I agree with you that my eldest son, I could never ask him to be a physician. He doesn't have the empathy. But my youngest son, he's kind-hearted, he's compassionate, and I could see him be a physician if he wanted to be. So I think you going after advice of your mom has tremendous benefits for you and for your family as well. So you did the right thing. My question for you is, where was your schooling? I honestly don't know about that, so I want to ask you.
Pardon me?
Where did you go for your high school or your college before you joined
Oh
the
yes,
Rawalpindi Medical
oh
College?
yes. My high school was it was nearby. I did my matric from Islamia High School, number 3. There are is a chain of schools, Islamia High Schools, and after that I joined Government College Asgar Mal, very famous college in Rawalpindi, like Government College Lahore. So I joined Asgar Mal College, and I did my higher FSC from there. And after that, that we got admission at Orthopedic Medical College.
Yeah, good, good. So we know, the RMC part of life, and I really think that was memorable, and we'll dig into deeper. You became an orthopedic surgeon, and what drove you to become orthopedic surgeon?
Farhan, it's like love at first sight. Uh,
Wow.
Probably, either you remember or not, Professor Salim used to come to take our lectures in our third year. So when he came to deliver the lectures, when I saw him, I really fell in love with that man. The way he talks, the way he delivered the lecture, the way he walks, and the way he taught us that orthopedics. I said, this is the field which I should join. And and really proud, if you remember, is of same getup, like having a beard and and the cap, and
Yeah.
he's from Jamaat. Yes, remember, very nice, gentle, polite, humble, and really nice man. So that was that time when I decided that I should join orthopedics.
Wow, you were.
And since 30, and
Do you
since 30,
remember? Do you remember being in an OR with him, or do you remember? Did you ever had to work with him closely?
oh yes, in OR we had I had an opportunity because my interest was there. So in final year, I was lucky enough to join him in OR, and I saw that he was working with drill machine and big saw and hammer, screwdrivers. So I saw this is an art with beauty. I mean, it's so precise, accurate, while even while using the big drill machines and saw and hammer. But it really needs very precision and accuracy in surgery. So that was a fascination, and the way he taught us. So at that time, then I did my house job in orthopedics even.
Wow. Now let me ask you something. Um, you must have been pretty strong, because when I saw those drills, I was like, no way I'm gonna pick up these drills and try to make holes. I can't put a nail in the door. I'm not gonna be doing that. So, do you remember being yourself pretty muscular and strong, and you could hold heavy objects?
Oh no! At that time, really, I was not really able to hold that. They called me as Chota. Just they called this Chota. Just bring this one. So I was thin, lean, and was not able to really to go with such a. It is really a tough job to do.
Yeah, it's a tough job.
But with the passage of time, yes, with the passage of time, we developed all the required, which is required for orthopedics, and alhamdulillah, now it looks like a piece of cake.
So any case that you remember that you were scrubbed in and you were fixing somebody and there was a big patient and you couldn't lift and you're like, what the hell am I doing here? Was there any event, any case that changed you as a physician, as a surgeon, any good or bad experience?
Yes, regarding some good experience or bad experience that I come across during earthquake in 2005. Probably you remember in Pakistan.
Yeah.
It was October 2005. It's a big earthquake, and I was working as a registrar in Pakistan Railway Hospital, and we received about 500 patients, and there was a small unit. One assistant professor and myself, we were working. Two orthopedic doctors were working there, and we have a couple of medical officers, those who were not even trained in orthopedics. And in 2 days, we received 500 patients. Oh, and it was Ramadan. At that time, it was Ramadan and we were fasting. And we never know what to do. But Allah has been very kind that he just showed us the path, the way. The whole team of surgical department, they came to us. Even professor said that I am ready to work as a house surgeon. Professor of surgery. Wow. He said that I'm ready to work as a house surgeon. You see, this was the passion. The people, they were so loving. The professionals, they joined us, and we really worked day and night in fixing the fracture. And in that time, a miracle happened that we advised a lady who was 20 years old, and she had almost gangrenous upper limb. And we said, we have to amputate this. And that she was not ready. Her husband was not ready, that we don't want an amputation. So myself, the other senior colleague, even professor of surgery, he said that I can give you in written, she's going to die if we don't amputate that. They said, okay, you just carry on, let her die. And wow. We were really in trouble. We were difficult situation, what to do at that time. So what I did, I just washed that upper limb and fixed it with an external fixator to make her life easy, that whatever time she is left with, she should have an easy time with that. And Farhan, believe me, she got well with that.
Whoa.
Really.
That's
really a miracle. Yes.
That's a miracle. That's a help from God.
Oh, yes, that's a help from God. So at that time, I said that we should not talk big, that everything is dealt by Allah, that Allah has been very kind. Said we become heroic and talking like that that she's going to die. No, whatever is written up in with God, with Allah, whatever He wants is there. So at that time, the things got changed in myself. That that nothing in our hand,
Yeah.
everything is in the hand of Allah.
What He
So we
has to
should do
save, He
professional.
will save. And who has to go, has to
Yes,
go.
oh, it has to go. So
My,
that really changed something in making decisions, in decision making. Sometimes
I
I
can
remember
feel a little
it's a
bit
day.
goosebumps on me by listening to this story about the patient. That was very
Ah,
nice, very
yes.
touching. So that changed you. Now, Nadeem, do you have a unique skill or a joint that you like to work more on as an orthopedic surgeon? Um, like, what is your favorite area of expertise within orthopedics?
Farhan, I'm fellow from Guy St. Thomas Hospital, London, in knee replacement, in knee arthroplasty. Uh, Basically, yes, I'm pretty good in that, in doing knee replacement. But unfortunately, in our Pakistan, in our part of the world, the affordability is a big issue. The knee replacement is an expensive procedure. So a few people can afford, but those who can afford, they do well with that, and it's really good for them. Uh, so my area of interest is knee basically, but I worked a lot in trauma,
Okay.
particularly in gunshot injuries.
So, Nadeem, I am intrigued by that statement you just made, and I want to talk a little bit more on it because my experience being in the United States for about 17 years now is you just agree to a joint replacement, and within a week you will have a joint replacement. And if you want two, you can get two at the same time. I have people who are bionics with their shoulders replaced and knees replaced.
Right.
I wanna talk to you a little bit about, but before that, I want to step back because I skipped the part where I want to know where did you do your orthopedic residency and your fellowship? Could you give us the name of the institutions?
Yes, my former training was at that time is Rawalpindi General Hospital, which is currently known as Benazir Bhutto Hospital.
Okay.
So I did my orthopedics training with the same professor which I was studying before, Professor Salim. And after complete, I did my all part of orthopedics with Professor Salim. Then I had an opportunity to work abroad, and I worked in with one of the most famous knee replacement surgeon of Guy St. Thomas Hospital, Mr. Peter Anshaw, in Gibraltar. It's a British dependent territory in Spain. Beautiful part of the world. It's a beautiful place and a very nice, humble gentleman. So I worked with him, and after doing my fellowship, I just started my practice in Pakistan. So having an experience of both working in Europe and in Pakistan.
Wonderful. You know, knee as a joint is, I think, is the most widely operated upon joint in America. And I think it would be all Western states because of the obesity epidemic that we have. Do you also find the same issues of knee? We have a lot of sports injuries too, because, you know, American football, baseball, and all those basketball, they tend to have higher rate of injuries. What is your reason? Why do people need operations on their knees in Pakistan?
You see, the sports injuries are not as common as in Western part of the world or in US, but they are common in Pakistan. Most of the people, those who are having sports injury, they get unchecked. Either they leave sports or they change sports. But professionally, those who have been doing, so I'm dealing with knee and ankle. So meniscal injuries are very common in our setup. And the people, even I have seen a couple of professional cricket players, those who have visited my clinic, and they were doing for under 19, and they had meniscal injuries, and they changed the profession, that they don't want to get it operated, that once they will get operated and they won't be able to play. So there are certain myths and misconceptions here in our part of the world. So it's very difficult to teach people regarding that if they get it treated, they will get cured and they will be back to the sports very soon. But I have been personally, if I share my experience, we have been doing arthroscopies, meniscectomies only. Even the arthroscopic anterocruciate ligament repair, It's rarely done. Rarely, it's very rarely done in our setup. But we have been doing that the ACL reconstruction, arthroscopic ACL reconstruction. But meniscal injuries are common, but people are not interested in getting the treatment of menisci. They just keep on going with that. They are happy with it.
Wow. I remember my father was in Army cadet, and he got an injury while doing one of his trainings during PMA military academy trainings. He never, all his life, he had arthritis of his knee. He never saw an orthopedic surgeon, was never able to go past that myth, as you said, misconception of getting treated. And he could never enjoy his life. He couldn't be as active as he would otherwise be. I agree with you that. And I think one of the reasons that I share the passion with you is medical literacy, improvement of medical literacy in Pakistan, globally, but especially in Pakistan. So thank you for sharing that and bringing that important topic. My next question for you is, you are an associate professor at Riphah Medical School, which used to be Islamic Medical University. I forget the full name. Could you please tell us a little bit about your current job?
Yes, I'm working as an associate professor of orthopedics at Riphah International Hospital. Basically, this hospital is attached with the Islamic International Medical College.
Okay.
And in that hospital, there are certain postgraduate specialties. I am supervisor from the College of Physicians and Surgeons as well. And but at present, we don't have trainees in our hospital at present.
I was looking through some of the information that is public knowledge about your role as a facilitator for the department DHQ Hospital, Rawalpindi Medical University. You conducted a FCPS training exam and intensive orthopedic exam. So share us a little bit about your motivation to do medical education within your field.
Farhan, this question is very important particularly for those trainees, those who are working in Pakistan as FCPS trainees. That when I was doing, I finished my training, there was no opportunity that how we can get a training to appear in an exam. You see, in Pakistan, College of Physicians and Surgeons has a very good pattern of exam, but we have not been trained in that. Unfortunately, the training lacks, and we have been working day and night, but we are not preparing ourselves for the exam. So we started, myself and my professor and my other colleague, we started conducting a mock exam, which is of same exam. You see, it's a mock exam as College of Physicians and Surgeons is doing. So we used to set up the entire atmosphere of exam, making all the 10 stations of interactive and non-interactive sessions, having short case and long case, showing them all the instruments, x-rays. So that was very helpful. And about 80 candidates used to appear in every 6 months in our mock exam. And our success rate was about 60% of the candidates they get through in exit exam.
Wow, that's huge. It's probably one of the only kind of formal mock exam training in Pakistan. I know that there are board exams that we do for internal medicine. I do it for rheumatology, and there's for everything in US. But this is amazing. Do you think that you would like to continue that? Are you still continuing to participate in that, or is that was only one time?
No, we conducted it 4 times.
Okay.
And even I left DHQ hospital about a year before, but they used to call me whenever we used to do after every 6 months. And last time we conducted this mock exam, and I acted as a supervisor, as an examiner there. And it was really a very good move from our department, and that helped a lot. We get a very good feedback, even from the professors, from trainees.
Wonderful. So let me ask you something about your current practice setting. What is your day like? Your OR days versus your clinic days?
Pretty busy. I have 2 OR days at Riphah International, and 2 outdoor days. During this time, I have lectures of third year undergrads and final year undergrads. So 5 working days at Riphah, 2 OR and 2 outdoor days, and one is academic days. We have like journal club and
Preparation
presentations
and yeah,
of
and
yes.
research. Do you work until like 7 p.m. there, or do you have a private clinic too?
No, I do have a private clinic. I used to work at my hospital Riphah from 8 a.m. to 2 p.m. And after that, I used to come home and have a lunch, offer my prayer, sometime with the kids. And then I used to move to my clinic. My clinic is a bit far away. Like it's about 45 minutes drive from my home. And my clinic is at 6 Road, Rawalpindi, Azema Shaikh Hospital. In fact, one of my friend, he built that hospital and about 2 years before. So I've been doing my private practice from 6 onward. So that we used to say कि जाने का time है, आने का time नहीं है. So by
Wow.
6 I used
I
to
saw
go. Yes.
I saw a YouTube ad or a Facebook ad of the Azema Sheikh Hospital. It seems like a brand new facility.
Oh yes, oh yes. We have state-of-the-art operation theaters, and is completely equipped. A very good intensive care unit, and some senior colleagues from anesthesia department, and that is doing pretty good. It's really good.
Mashallah, that's very nice to hear. Now, is that hospital a how many beds does it have?
Currently, we have about 30 beds.
Okay, that's pretty nice.
Yes,
Wonderful.
yes. It's we have yes, pretty good space, and orthopedics is quite exclusive.
I can see that because orthopedics, risk of infection, post-operative infection, just like neurosurgery and everything, it's important. So I'm glad you have a good facility. Nadeem, what is your biggest hurdle with your life? I know you are a satisfied, content person. You always, have gratitude about what God has given you. But are there any hurdles that you want to share with us?
Farhan, hurdles, yes, it's a part of life. Hurdles in every field. What I felt that when I was developing my private practice, uh, I was short of money at that time, in a sense that I could not make my own setup. That to develop an orthopedic setup, we need big amount of money. Like you need a complete operation theaters, some equipment which is really expensive in orthopedics. So at that time, some finance was the hurdle that I wanted to make my own setup. But I worked is one of the busiest hospital and private setup in Rawalpindi was Ahmed Medical Complex. I worked there for 7 years, and I used to have a complete list every day in my private practice. About 5 patients, 6 patients per day used to operate, and we used to finish quite late at night. So hurdle was basically initially the finances, nothing. But after that, I realized that instead of putting myself in a very busy schedule, running my own clinic or my own hospital, that I should work in a hospital and get my share and made my life easy. So that I'm doing pretty well with that. That I used to work in someone's hospital and getting my share. That is more than enough for me, alhamdulillah.
It's like you probably are stronger together as long as there is a good understanding of the deal is fair and its market value, and you understand that there is a support from administrative end to meet your needs and be fair in your compensation. So I agree with you, and most of us have also kind of learned through our mistakes and eventually understood the same came to the same conclusion. So wonderful. Now let me ask you, with this current job and you being active in training, where do you see yourself in 5 years from today? How would you like to be recognized further?
Farhan, in fact, I did a lot of private practice. Now I am really, if you ask me, I just want to spend my evening at my home.
Good.
But there are certain requirements which are really required. My passion is to train the postgraduate trainees the way which is really required. So I've been doing a lot of research work, and I put more emphasis on training of the postgraduate residents, that
Good.
they really need a format. They really need a set protocol which is being designed by College of Surgeons. But unfortunately, in about 90% of the centers, those rules and regulations are recommendations which are initially by the College of Surgeons, is not being followed by the residents. So my passion is to train the trainees. And I'm writing a book on osteoporosis in Pakistan, and the bone health in females and women, bone health in Pakistan.
Wow, that's there are a lot of things that we both have in common in terms of, you know, we both are musculoskeletal doctors. You are the
Oh, yes.
better one, and I'm just the one who talks. But I think that's wonderful. We will talk more about it. I think eventually we'll dig deeper into diseases and discuss among ourselves how we can help our communities. I want to bring up an issue that is very close to you and you're passionate about, is helping Kashmiri community within Pakistan. And there's been a lot of concern all over the world about, like, you know, recent issues with Indian held Kashmir. Uh, what would you like to be done for people in Kashmir in terms of medicine that you think they're significantly lacking right now?
Farhan, if we talk about Pakistan part of the Kashmir, so we lack a lot. Like couple of years before, like couple of years means about 5-6 years before, they had medical colleges, just 2 medical colleges there. Literacy rate is really good, and the people are intelligent. They really want to learn. They really want to study, but opportunity for study is difficult there. So the people, they do lack in particularly in medical schools. So unfortunately, those who get the admission in colleges where in Kashmir, and about quite a good number of students are left, those who are not able to get admissions in the other medical colleges, because the limited seats are available in Kashmir, and good number of students are coming in, they wants to join medicine, but they don't have the opportunity in Pakistan, particularly in Punjab, to get some special quota for Kashmiri students to get an admission. So they removed the quota for Kashmiri students, and now there are 2 medical colleges which they are serving Kashmir. As far as the Indian held part of Kashmir is done, we are completely disconnected. Last time the photograph which I shared on Facebook is about 5-6 years before. My uncle, he visited from Muzaffarabad route. At that time is with bus service, which was by mutual understanding of Pakistan and India, and they started bus service, and he came once, and after that we have no connection, unfortunately.
So, Nadeem, I want to ask you something about medical colleges in Kashmir. In Pakistan, there's only one kind of medical degree, the MBBS or MD equivalent, right? In America, they have osteopathic medicine clinics too. Now, those are DO doctors that can actually practice similarly in all fields of medicine. Do you think that there would be a time in Pakistan that we would be able to introduce another type of medical school, if not grow the number of medical schools which exist? Or do you think it will be too much a political problem in Pakistan to start osteopathic medical institutions?
Farhan, I think to start with osteopathic in Pakistan, I guess it won't be feasible for the government,
Resources.
and for the resources, difficult to start with. But the idea of having the other sort of medical degrees, are the providing helping the doctors. There should be some separate courses, those who can medical helpers.
Yeah, so
We
like
can
medical
just
assistants or nurse practitioners that we have,
yes,
we call it advanced physician, advanced providers. They tend to help physicians, like physician assistants. I think that's a very
yes,
good point you raised. And in America, because of the aging population, the doctors are not enough. People don't want to take that much debt to go into medical schools. So they have these smaller courses. You can graduate from college and do 2 years and become a physician assistant. You make half the salary, but you also go into workforce quickly and you have a lighter schedule, less responsibility, but it helps doctors take away the lighter work. And I think that's a great suggestion you made. Okay, wonderful. I think that's wraps up our professional part.